Welcome to RSSDI TV 2020. I am Dr. Ruchi Shah, and on behalf of Wokhart RSSDI TV 2020, I welcome you all. I am glad to have with us today renowned endocrinologist from Bangalore, Dr. S R Aravind sir. Sir is the director, Dicon Hospital, Bangalore, and past president, RSSDI. Sir has a rich clinical experience in managing diabetes patients. Welcome, Dr. S R Aravind, to the show.
Thank you so very much, Ruchi. Great to be here at the RSSDI TV, and as a past president, I'm extremely happy that RSSDI is moving leaps and bounds with the new initiatives. And thanks to Wokhart, this looks like a great initiative.
Thank you so much, sir. So, sir, based on your recent talk in RSSDI 2020, which is a Steno 2, a tale to tell, we would first like to know how is Steno 2 different from the UK PDS?
Well, Ruchi, you have to go back to 1993, and UK PDS was not even started at that time. That was a time when things were still evolving, and we were trying to find out whether glycemia per se has anything to do with the complications. I mean, even though there were smaller trials which looked at good glycemic control and showed benefits in microvascular complication, Steno 2 was the first trial which looked at treating multi-pronged approach. That means they were looking at tight glycemic control, they were looking at tight blood pressure control, they used statins and aspirin for multifactorial risk factor reduction. And the follow-up of this Steno 2 has now gone on for almost 21.2 years, which none of the other trials actually have shown. So I think even though the numbers were less in Steno trial, 160 patients overall, but the messages it's trying to tell us is something that all of us should remember, that tight glycemic control, blood pressure control, usage of statins and aspirin has a great value in treating our patients.
Okay, thank you so much, sir. So, sir, the next question will be, did the legacy effect in macro expected at that time?
Well, I mean, that's a great question, because initially this trial was designed to look at the complications, and at the end of 3.8 years, roughly 4 years, when they looked at the results, there was a great reduction in microvascular complications. And there were no benefits at all in terms of microvascular complications. People back then were a little disappointed that, look, no matter what you do, even if you go for intensive therapy, probably we may not see a risk reduction in the macrovascular events, especially the cardiovascular events. But then when they went on to follow up these cases for 7.8 years, later on for 13 years, and now for 21 years, as of 2018, they found a great reduction in macrovascular complications, especially the CV death. And even though the control of blood glucose, blood pressure, and other things were equal after the trial ended, the legacy effect was seen. So that clearly tells us that, look, if you want benefits of macrovascular complication, you need to start early, hit hard, and wait for the results. It's not that you have a quick fix effect and then get the results in 3 or 4 years. So good control for long periods of time has a great benefits on cardiovascular risk reduction.
Thank you so much, sir. So the last question would be, can you please precisely tell about the heart failure in the Steno 2 trial?
Well, this was not expected at all. In fact, nobody really looked at the heart failure then, but then right now there is so much of talk about heart failure being the most important thing in diabetes. People have started to look into the data of Steno 2, and what they found was, when they compared intensively controlled arm and conventional arm, there was a reduction of 70% in the cardiac events, and especially hospitalization due to the heart failure. So, overall, early intensive glycemic effects are remembered by the target organs like eye and the kidney, and over a period of time, you are seeing the legacy effect. So the Steno 2 is the first trial to show that benefits of multifactorial intensive intervention has absolutely positive legacy effects, which sustain for almost 13, 14 years. And there was a reduction in all-cause death, and there was actually a gain of almost 8 years in life, and almost 8 years of free life without any CV events. And there was a 70% reduction in the risk of hospitalization due to heart failure. and it also turned out to be that it was absolutely cost effective. And this was something that was proved in a trial which was designed in 1993. And there is a message, and there is a tale, and there is a story that, okay, repeatedly we are realizing, yes, glycemic control is extremely important, but a multi-pronged approach is something that we have to follow in all our patients with type 2 diabetes if we have to add more life to them and then give them free life without any CV events.
Thank you so much, sir, for sharing your views on the Steno-2 trial, and stay tuned to RSSTI WOCHAT TV 2020 for more recent updates from the RSSTI 2020. Thank you very much.
All the best to OCART and RSSDI TV. Cheers.